Are you noticing a lot more pink around you? Well, it's all about breast cancer awareness, and you'll see pink everywhere this month. This year, 268,000 people will be diagnosed with breast cancer. 42,000 will lose that fight. So Dr. Kerry-Ann McDonald, breast surgeon at Lynn Women's Health and Wellness Institute, part of Boca Raton Regional Hospital, joins us now to discuss more about what women and men, for that matter, need to know about this disease. So thank you so much for being here.
Thank you for having me.
Really important that we all understand this. Talk to us first. Are mammograms still the best way to detect breast cancer?
Yes, mammograms are the best way to detect breast cancer. It is the gold standard for breast screening. Mammograms correctly identifies approximately 85 to 90% of breast cancers. And although mammograms are an effective screening tool for a majority of women, they're not perfect. So mammograms do miss a small percentage of breast cancers, and that is why it's very important for women to have individualized, comprehensive, personalized breast screenings.
Yes, really such an important reminder to take charge of our health.
Yes.
Talk to us, when should women get that first mammogram?
Yes, that's a very important question. In general, women should have a baseline screening mammogram by the age of 40 and screen annually thereafter. Women who are of higher risk should start their screening at an earlier age, but it's not really a one-size-fits-all mentality. The timing of screening, as well as the resources used to screen, are influenced by a woman's risk.
Yeah, and risk, of course, could be family history, if you have carry a BRCA gene, all of those things that we've been talking about.
Right.
So much. When a woman has a mammogram, what are the questions she needs to ask to make sure that the latest and best mammography equipment is actually being used, the best qualified people are involved? Because there are so many people out there. If you were to just Google it, what questions should we ask?
Sure. I think when you're looking for a facility, I would say choose a place that specializes in mammograms and does many mammograms a day. And so these include facilities such as high volume hospitals and mammography centers. When choosing a facility, you should look for a place that offers 3D mammograms, because 3D mammograms do detect slightly more breast cancers than standard mammograms alone. I always think it's nice if you can go to a place that offers same-day results.
Oh, yeah.
To decrease your anxiety over the test that you just completed. And I also encourage women to have their breast imaging at the same facility every year to make it easier to compare their mammograms on an annual basis. Lastly, I think it's also important, if you can go to a high volume center, you're very likely to have a specialty trained breast radiologist that's reading your imaging.
Yeah, that's so important. You have the result, but you need somebody to really understand what they're looking at.
Right.
So important.
Exactly.
Now, are there certain groups of women who might be at higher risk? We kind of touched on this earlier. Who's at higher risk for breast cancer?
Yes, there are certainly groups of women who are at higher risk, and those include older women, women over the age of 50, women with a personal history of breast cancer, women with a family history of breast cancer, and it also includes women who have genetic mutations that predispose them to developing breast cancer in the future, such as BRCA, like you mentioned earlier. Right. There are also populations of women that are at increased risk. So Caucasian non-Hispanic women have a higher overall incidence of breast cancer. And unfortunately, African American women have a higher mortality or death rate due to breast cancer.
Wow, it's really important. And even if you think you're at low risk, it's still important to get that baseline and continue with those regular checkups.
Yes, because early detection improves outcomes, so that's very important to get your annual mammograms.
Okay, ladies, and for that matter, men, make sure you're taking care of your wellness. And we so appreciate you, Dr. McDonald.
Thank you.
And we want to mention Lynn Women's Health and Wellness Institute is offering some special rates for mammograms this month. Go to the website. It's right there. We'll put it up. It's right there on your screen, okay? Go there for more information. You can also check out WPTV.com.